While COVID-19 has affected many people physically, it can also take a toll mentally. WDHN's Allison Polk talked to a behavioral health expert on what effects the pandemic has had on mental health. Allison, what did she have to say?
Well, Amanda, I spoke to MAO Behavioral Health Director, and she says that isolation due to the pandemic heightened many feelings of stress and anxiety, but there are ways to prevent those effects from lasting long term.
With COVID-19 comes social distancing and in some cases isolation. While worrying about your physical health is important during this pandemic, your mental health is just as important.
There were a lot of adjustment issues that came along with the COVID pandemic. And as a result of that, a person's mental health status became compromised, okay?
Merriweather says the social effects due to the pandemic resulted in high levels of stress, anxiety, and depression. This is linked to the isolation that the world went through during the peak of the pandemic. She says that as humans, we need social interaction to feel connected.
It is a natural and a normal need that all of us have to interact, to engage, but also to connect, okay? And frequently, that actually helps to improve a person's mental health.
Merriweather says the toll the pandemic had on mental health could have long-lasting effects, but says there are steps that you can take to help prevent those issues from lasting long-term.
So when people are able to self-assess themselves, if people can open up and communicate and just share what they're feeling, it could prevent potential mental health issues down the road.
If you're struggling with mental health, there are many resources that you can use to talk to someone who can help. Just a few of those numbers are on the screen. And Merriweather urges everyone to pay attention to their mental health and that it's okay to express that you're not okay and that you need help. Now back to you, Amanda.